So because some people do bad things and bad name comes to the country. So we all being educated people, responsible people, we need to bring the change in the mindset of people, especially from the mosque pulpit. Thank you very much.
Thank you very much, ma'am. I do appreciate your feelings. And we do hope that people are educated enough so that they could respect each other, not only on the basis of religion, but on the basis of humanity. Human first. The next guest speaker, she is Assistant Professor from the Department of Psychology, Dr. Anila Mukhtar.
Assalamu alaikum and very good afternoon to the respected guests, organizers and respected audience. I am Dr. Anila Mukhtar, Assistant Professor and Consultant Psychologist, Department of Psychology, University of Karachi. I am very grateful to the organizer, Department of Peace, for organizing this very important event and conference. They would like me to share my views on the impact of war on mental health of the individuals. Not only with reference to the individual capacity, but the community capacity as well. So my colleagues have already talked about Dr. Amna, Zehra and Dr. Zaiswani in the first half. They both talked about the different references of impact of war and the resilience impact and mental health relationship. But I just wanted to share a few points that because of the shortage of time, I'm saying that's a small viewpoint. And I'm sure that each and every point which I'm going to share needs an extended version, of course, which I don't have time right now to explain. But as the intellects, we can have the idea that what is going on. So I just wanted to extend the concept of the impact of wars, or violence, mental health, the individual, and step forward with children's, right? So children's are our future. They are nowadays children, and then they become the younger ones, and then they become adult, and they become the functional member and influential members of the society in different walks of life. So definitely they are important asset of us. So I just wanted to extend the impact of war beyond anxiety, depression, and PTSD. Why I have said this one beyond this? Why? Because most of the time when you are asking this particular question, that what can be the negative impact of war or violence on the mental health of the individuals, very common responses can be like anxiety, fear, depression, PTSD, and this can be done to the very layman, right? There is nothing needed to be there with reference to like psychology or professional or psychologist, educationist. A layman can, and the housewife can even tell the one anxiety, they can use the word anxiety, depression, right? And most probably, the more professional are using the word PTSD, but not beyond that one. So, have you talked about this one before, or are we thinking really? So, next slide, please. Right? For example, when we talk about, can I have the last slide? Right. Now, if we are going to find out, I just making your attention toward this very simple point, that if you look at the word violence, this is not subjected to wars only. This is like domestic violence or the at home, verbal, physical, right? There are many. So I just wanted to give a note on that side, that what is happening with a child when the child is facing the local and no war situation, and they are facing the violence at home even, then what is happening to them? Can I have the next slide, please? So it can develop the brain impairments, the normal, like if a child is seeing, watching, experiencing the violence at home even, no war situation, they can have this impaired brain and nervous system developmental issues. They can have the endocrine system issues, they can have the digestive issues, they can have the eating issues, they can have the respiratory and immunity system issues, they can have the ultimately cognitive development can be at risk when the child's intellectual abilities are going to be at risk just because of that violence if they are facing, experiencing or watching. Then the next piece. They can develop the negative coping and health risk behaviors as well. They can, like at the age of as minors even, we have seen cases that they be indulged in the smoking behavior, right? The class 4, class 5, right? Beyond your imagination that once when we were kids, the smoking was like adults are doing smoking, right? But nowadays we can see this one. And as a psychologist, I'm facing the reasons behind it. So one of the reasons is that way. So smoke, misuse alcohol and drugs, engage in high-risk sexual behaviors at very early ages. Of course, anxiety, depression, and mental health problems are there. Next slide. So, it can also contribute to the wider range of communicable diseases. Like, for example, non-communicable diseases are when you are talking about the cardiovascular risks, cancer, diabetes, right? This and by the way, what I am sharing right now, that's a very short and brief review of all the research work. This is not the only literature overview. This is the research work, and just because of the shortage of time, I'm not giving you the references of each and every research, right? So the child can have these problems at high risk, right? And they can be indulged into the less very weak kind of coping strategies like vaping, substance abuse, smoking. They can indulge themselves into that side, which is not effective coping strategies, of course. Then next piece, thank you. It can also have the negative impact. The violence can extend its negative impact to the opportunities and future generations as well on the whole. Now that's what I am talking about beyond anxiety, depression and all, right? If you look at this one, that is very common when the child is witnessing abuse and violence, drop out from the schools, right? Many times when the child don't want to go to school, that is because that they are facing some kind of violence in the schools, right? They are seeing that and they are being bullied by the people, right? So it's very common, right? Difficulty finding and keeping a job at the end when they are moving toward their future, and they can be later victimizing or being perpetrator of interpersonal and self-directed violence. They can be the victims, they can be the perpetrators, they can be involved into bullying others, right? Because they are being victim of the violence, so they will do the same, right? So saas bhi kabhi bahut, it can be like that. Okay, then can I have the next slide, please? So when we look at the point of demarcation, I have just shared the views of a very domestic and local kind of violence with you. So can you please think or imagine that what the war can do. Right? If we talk about the normal no war situation impacts on mental health of the children, then can we all just pay attention to this particular question, that what happening with the children who are facing the war right now, or in other times, right? Salon se ho raha hai. That's from the very history is just filled with many traumatic experience like war, right? So it can be definitely, it's a huge destruction, massive destruction is there when they are facing. What they are facing, the war, facing war children, they are facing the loss of home, they face the loss of family, they can have the destruction in their schools, school buildings, and nothing left, right? They can have the loss of friends, they can witness